Good evening and thanks for joining us. We begin with what could be a tipping point in the spread of COVID-19. The World Health Organization now says there are more new cases of the coronavirus outside China than inside that country. There are cases in every continent except Antarctica now. With attention shifting from Asia to Europe, countries there are struggling to come up with a unified response. And with so many unknowns, there's confusion about whether to travel and what to avoid. Here's what we know about where the virus is spreading outside Asia. Right now, the biggest outbreaks are in Italy and Iran. And from there, the infection is spreading kind of like a web across the world. People who had been in Italy are now linked to cases in Algeria, Austria, Croatia, Germany, Greece, Spain, Switzerland, and Brazil. And people who had been in Iran are being linked to new cases in Bahrain, Iraq, Kuwait, and Oman. Canada has recorded a second case in someone who traveled from Iran, and it's the 12th confirmed case here. At least 46 countries and territories have detected the virus, and dozens of passengers who were let off the Diamond Princess cruise ship in Japan have now developed symptoms, and a fourth person has died. Now, another cruise ship has run into trouble as well. 6,100 people are on board the Meraviglia. It's been turned away from Jamaica and the Cayman Islands because a crew member has flu-like symptoms and is now in isolation on board. The cruise ship company says it's just a case of the flu. The ship is en route to its next port of call in Cozumel, Mexico. And in Italy, more than 400 people have tested positive for the virus. That's the biggest outbreak outside Asia. Crystal Gamansing has our top story tonight.
Chemists in Milan are mixing up batches of hand sanitizer. Customers concerned about the new coronavirus bought up all of the available stock. Italy is the center of a European outbreak. Red zones in the north are being patrolled by members of the military and police. Anyone trying to sneak in or out could be jailed for 3 months. This Saskatchewan woman is stuck in Milan waiting.
Our classes were suspended for the following week, so this week. And that's basically all we've heard so far.
Iran is another location of particular concern. It's believed there are far more COVID-19 cases there than Iranian officials are reporting. A special investigative team from the World Health Organization will arrive there this weekend. Similar teams were deployed to China, and one is working in Italy.
We take the virus and the situation very seriously. At the same time, we should also remember that 4 out of 5 patients have mild symptoms and recover.
The fact that COVID-19 can be mild in some could be obscuring the true number of infected individuals. Dr. Michael Gardam says it's likely there are many more people out there with the virus.
We have not stopped anything. And I think that, the academics, the people like me who are out there looking at the epidemiology, I think there's pretty good agreement that we are heading towards a pandemic.
Slowing the spread is critical, but responses are different in each country. In London, for example, the energy company Chevron told people to work from home until test results come back for a worker with flu-like symptoms. The UK has 13 cases. South Korea has more than 1,000 cases, but buses are still rolling after being disinfected. In uneasy times, this driver says it gives him a bit of comfort. Crystal Gamansing, Global News, London.
Preparing for a virus that's new to humans and that experts still don't fully understand isn't simple. Canada does have a plan on how to handle pandemics. Tonight, Mike Lecouture takes a look at the mechanisms that are in place to tackle an outbreak. Mike?
Well, Donna, as COVID-19 has evolved into a wider global outbreak, so too has the federal government's approach to it. While the health minister says the current risk in Canada is low, Patty Hajdu is acknowledging that could change.
Globally, there's a higher likelihood that we'll see an outbreak in Canada.
Hajdu doesn't want Canadians to panic, but she says it could be prudent for people to be prepared just in case.
It's really about, first of all, making sure that you do have enough supplies. If someone in your family becomes ill, if you yourself become ill, that you have what you need to survive, for a week or so without going out.
Hajdu says Canada's National Microbiology Lab in Winnipeg has a more robust test for the coronavirus than the U.S. So in some ways, we're better prepared for a possible outbreak. And she added there's a federally coordinated pandemic plan that's been in place since 2009.
There are a lot of similarities to how we would manage this compared to H1N1.
Dr. Susie Hoda says some of the lessons learned from that outbreak and SARS were to ensure proper screening and proper protection for healthcare workers. Then there's the plan for people in the community, from things as simple as frequent hand washing to a more extreme step of suggesting people avoid mass gatherings.
Sometimes schools and other areas where people are congregating quite a bit can get closed. So we modify the way that we interact with each other so we reduce that risk of people exposing each other.
Canada isn't there yet, and to further calm fears, Ontario's chief medical officer says we have a distinct advantage compared to past outbreaks.
We know the organism, we have a lab test, and fortunately for us, we have the experience of what China has worked through. And we have our epidemiologists and our experts informing us what they learned, what they know, what we do with this virus.
Doctors say sharing information internationally can help mitigate a global pandemic, adding 10 years ago, that level of coordination and collaboration didn't exist. Donna?
Okay, Mike Lecouture in Ottawa, thanks. In the U.S., President Trump just addressed the American response to the virus. He's blamed the media for making it look as bad as possible. Today, he said he doesn't think the spread of the virus is inevitable, even though that's what officials from the American Centers for Disease Control said yesterday. There are 60 confirmed cases in the U.S. now. That number is likely higher, though, because few people have been tested, and many test kits were found to be faulty. Jackson Prosco has been listening to the president. Jackson, what's his message?
Well, Donna, the president spent most of his press conference repeatedly downplaying the threat of coronavirus, suggesting it's very much the same as the flu, even though its mortality rate is much, much higher. Trump, in fact, expressed his own shock at learning about the mortality rate of the regular flu. He bragged that the U.S. is better prepared than any country. He said all cases of coronavirus in the U.S. will still be gone. That does not jive with what his own experts have been saying in recent days. They've proclaimed that it's practically inevitable that coronavirus will arrive in larger scale and community transmission here in the U.S. In the near future. He also said that a vaccine will be here soon. His own experts have said it's a year to 18 months away. Bottom line, Donna, he's taking issue with the idea that spread here is inevitable. Take a listen to what he said a short time ago.
Well, I don't think it's inevitable. It probably will. It possibly will. It could be at a very small level or it could be at a larger level. Whatever happens, we're totally prepared. We have the best people in the world.
Jackson, the president, sounding very optimistic. Not many people in the U.S., though, have been tested. I think it's about 500. That compares to tens of thousands of people in countries like South Korea. And the CDC has admitted that some of its test kits are faulty. What's going on?
Yeah, there's a real concern here that no one has a full picture of the spread of the virus here in the U.S. or whether community transmission is already taking place because of those limits in testing capacity. As you mentioned, faulty kits, they've been very narrowly distributed to only 4 or 5 sites. The situation's so dire for some health authorities that in Hawaii, they've asked to send their samples to Japan for verification. Donna, the president has appointed his vice president, Mike Pence, to oversee all these efforts, but suggested that there's no need to ramp up testing capacity right now.
All right. Jackson Prosco in Washington, thank you.